COVID-19 usually lasts for 2 weeks, but some symptoms may persist for several months, such as palpitations, breathing problems, difficulty breathing, feeling lightheaded, fatigue, loss of smell, loss of taste. If these symptoms last more than 4 weeks, it is called long COVID. Long COVID may persist more than 1 year. Older people and women have more risk of long COVID, but anyone, even children and otherwise healthy people, can have long COVID. People with asthma have higher risk of developing long COVID, and 2/3 of people who had COVID-19 have risk to develop long COVID. The most common symptoms are fatigue, feeling lightheaded, dizziness, palpitations. Palpitation is when you're aware of your heartbeat, cough, breathing problems, difficulty breathing, sometimes impaired memory, concentration problems, loss of smell, loss of taste, depression, anxiety, muscle pains, and these symptoms are worsened during physical activity or mental activity or during stress. There is no definitive answer what causes long COVID, but there is 3 possible scenarios. First is when virus invites body's immune response is overdrive, and body's immune system attacks own tissues, and it is called autoimmune reaction. And maybe immune system attacks and damaging its own tissues and cells. Second version is virus itself attacks body's tissues, such as blood vessels, and when it attacks blood vessels, we have heart problems and lung problems, and it can directly damage nerve tissues also, and we have loss of smell, loss of concentration, loss of taste, and such impaired memory and brain fog and such symptoms. And third scenario, maybe virus stays in the body, and after some time it reactivates, and it starts replicating in the body, like herpes virus. Herpes virus have same scenario. It stays in the body, and after some time it attacks organism again. So these 3 scenario is possible. Why we care long COVID at all? We care because it affects people's quality of life. Some people have depression after COVID-19. Some people have anxiety. Some people have difficulty breathing, and it directly affects their productivity. It directly affects of their quality of life. So it's problem, of course. And second important fact which we consider when we're talking about COVID-19, not only about long COVID, but also COVID-19, is that the people who had COVID-19 have higher risk of death next 6 months after having COVID-19. So people have 60% higher risk of death after having COVID-19. Of course, it does not mean that every 60 people out of 100 who have COVID-19 will die. Of course, it does not mean this. It means that only risk will increase. There is no proven method of treatment of long COVID, but gradually increasing activity, diet, exercising, and managing symptoms can be effective. Prevention of long COVID is prevention of disease itself. So vaccines and vaccination are effective to prevent long COVID and COVID-19 itself. Of course, there is no 100% effectiveness, but it's still effective. And it decreases severe disease, and it decreases death risk also. And furthermore, there is evidence that a vaccine decreases chance of long COVID. Even people who had COVID-19 before vaccination.